I'm just laughing. I'm sitting here and I'm laughing. It's ludicrous because look, in 2017, when this government came in, on the wings of a lot of us thinking that the previous government had been symbolic, and I make no apologies for my views then. The first thing they did was to pass a law to say statutory payments could be capped, and they could then decide what they were going to use it for. What they didn't realize, and that is why I always go by data, they didn't look at our 10-year disease trends to realize that our disease burden as a country was doubling. And we were moving from a situation where predominantly infectious diseases were the mainstay of our disease burden to a stage where chronic diseases are the mainstay of our disease burden. So, for example, currently, if you look at 2022 data, malaria is still the leading cause of mortality, but its contribution to our mortality has dropped by 46.6%, whereas strokes have gone up by almost 10%. So if you go capping the funds when the diseases that are causing people to die are more expensive to manage, you cannot convince me that the NHIS, and that's why you've seen on my social media handles, I've asked the question, those people telling me and Ghanaians that the NHIS should take on and fund dialysis, where are they going to get the money from? The truth of the matter, and that was why some of us raised hell when this whole capping law was going in. The truth of the matter of a health insurance scheme is that you expect them to have an excess of inflows so they can invest it. So when they are recalled to pay for some of these more expensive procedures like chronic diseases, dialysis, prostate cancer, breast cancer, they can get money out of the investments they have made with the premiums they have received to pay for them. But this government, in its wisdom, telling us we have the men, took the money and said they can prioritize where the money should go. So I'm now listening to someone from the NHIS telling me that we are not liquid. And I'm saying, now who costs up? How can you be liquid when you never invested the monies that were coming to you for 6.5 years? You can't be. And that's why, though we are having a serious conversation, I am laughing. Because I'm like, we shot ourselves in the foot, and now we are bleeding, and we are saying, how come the gun hurt? The gun was going to hurt. It was a bullet, for God's sake. It wasn't a sponge. It was a bullet. We shot ourselves. We expected to bleed. And this is why I'm saying this conversation should have happened yesterday. But it's happening now. So let's think of making sure that a lot of things like this whole capping and other things are repealed as a matter of urgency. Because I cannot sit here and say it's just straightforward. The NHIS should take over funding of dialysis. They cannot afford it.
Okay, stay with me.
And they cannot afford it because of our laws.